We all know how important regular checkups are for our cars. We wouldn't dream of driving thousands of miles without an oil change or tire rotation. Yet we often neglect the most important machine of all, our own bodies. Just like your car needs regular maintenance, your body benefits from routine health checks. One of the simplest yet most powerful tools in a doctor's arsenal is the Complete Blood Count, or CBC test. Think of the CBC as a report card for your blood. It provides a snapshot of your overall health, revealing crucial information about your red blood cells, white blood cells, and platelets. These tiny components play a big role in keeping your body functioning properly. From transporting oxygen to fighting infections, their work is vital. You might be thinking, but I feel fine. Why do I need a blood test? That's the thing about many health issues. They can silently develop without any noticeable symptoms. A CBC test can detect subtle changes in your blood, often before you experience any warning signs. This early detection is critical in preventing serious illnesses and complications down the road. What does a CBC test measure? It starts with a small vial of blood. Analyzed in a lab, it reveals your blood components. Red blood cells carry oxygen. Hemoglobin fuels them. CBC measures their count and size. White blood cells fight infections. CBC counts different types. Platelets help clot blood. CBC measures platelet count. Getting ready for a CBC test is usually a breeze. In most cases, no special preparation is required. However, your doctor might ask you to fast for a certain period, typically 8 to 12 hours before the test. This means abstaining from food and drinks other than water. Fasting helps ensure accurate readings, as certain foods and beverages can temporarily affect your blood sugar and lipid levels. Staying well hydrated is also important before a CBC test. Drinking plenty of water can make your veins plumper and easier to find, making the blood draw process smoother. Avoid sugary drinks or caffeine before the test, as these can dehydrate you. If you have any questions or concerns about preparing for your CBC test, don't hesitate to contact your doctor's office for clarification. We all know that needles can be intimidating, even for the bravest among us, but fear not, there are ways to make the blood draw experience as painless and stress-free as possible. Communication is key. Let the phlebotomist, the healthcare professional who draws your blood, know if you have any anxieties or concerns. They are trained to make the process comfortable and can offer reassurance and support. If you tend to feel faint or lightheaded during blood draws, inform the phlebotomist. They can have you lie down during the procedure to prevent any discomfort. Looking away while the needle is inserted can also help minimize anxiety. Focus on your breathing or bring a distraction like a book or music to take your mind off the process. For children, a little distraction can go a long way. Bring their favorite toy, sing a song together, or have them blow bubbles to divert their attention. The use of a butterfly needle, a smaller and shallower needle, can also make the experience more comfortable for young patients. One of the most compelling reasons to get regular CBC tests is their ability to detect health issues in their early stages, even before symptoms arise. This early detection is crucial for successful treatment and better health outcomes. For instance, a CBC test can reveal iron deficiency anemia, a common condition that can cause fatigue, weakness, and shortness of breath. Early diagnosis and treatment with iron supplements can prevent complications and improve overall well-being. Similarly, the test can detect vitamin B12 deficiency, another type of anemia that can lead to neurological problems if left untreated. The CBC can also serve as an early warning system for more serious conditions. Abnormal blood cell counts can sometimes indicate certain types of cancer, such as leukemia and lymphoma. While further testing is needed for a definitive diagnosis, the CBC can provide valuable clues that prompt further investigation. By identifying these issues early, healthcare providers can intervene promptly and potentially prevent them from progressing to more advanced stages. This proactive approach to health can make a world of difference in your long-term well-being. Section 6. Anemia, a common culprit revealed by the CBC. Anemia, a deficiency of red blood cells or hemoglobin, affects millions worldwide. The CBC test is crucial for diagnosing anemia and guiding treatment. Iron deficiency anemia occurs when the body lacks sufficient iron. This can result from inadequate intake, blood loss, or absorption issues. The CBC detects iron deficiency anemia by measuring red blood cells. Vitamin B12 deficiency anemia is another type revealed by the CBC. Vitamin B12 is essential for healthy red blood cells. A deficiency leads to large, abnormally shaped red blood cells. This anemia can result from diet, malabsorption, or medications. The CBC helps tailor treatment for specific anemia types. Iron deficiency anemia is treated with iron supplements, while vitamin B12 deficiency anemia requires B12 injections or dietary changes. Section 7. Infection detection. Your white blood cells on patrol. Your white blood cells are the sentinels of your immune system, constantly patrolling your bloodstream for signs of infection. The CBC test provides valuable insights into your body's immune response by measuring the number and types of white blood cells present. An elevated white blood cell count, known as leukocytosis, often indicates that your body is fighting off an infection. The type of white blood cell that is elevated can provide clues about the nature of the infection. For example, a high neutrophil count often points to a bacterial infection, while an increased lymphocyte count might suggest a viral infection. Conversely, a low white blood cell count, called leukopenia, can signal a weakened immune system. This can occur due to various factors, including certain medications, autoimmune disorders, or bone marrow problems. Leukopenia can make individuals more susceptible to infections and may require further investigation to determine the underlying cause. By analyzing the white blood cell count and differential, healthcare providers gain valuable information about the state of your immune system and its response to potential threats. This helps them make informed decisions about treatment, such as prescribing antibiotics for bacterial infections or recommending further tests to investigate immune deficiencies. Section 8. More than just numbers. CBCs in chronic disease management. Beyond diagnosing specific conditions, CBC tests play a crucial role in monitoring the progression of chronic diseases and assessing the effectiveness of treatment. For individuals with long-term health conditions, regular CBC monitoring can provide valuable insights and guide treatment adjustments. For people living with diabetes, CBC tests can help monitor blood sugar control over time. Elevated blood sugar levels can damage blood vessels, potentially leading to complications such as heart disease, stroke, and kidney problems. Regular CBC tests can detect these complications early on, allowing for timely intervention and management. In individuals with kidney disease, CBC tests are essential for monitoring kidney function and detecting anemia, a common complication of this condition. Damaged kidneys may not produce enough erythropoietin, a hormone that stimulates red blood cell production. This can lead to anemia, which the CBC can readily identify. Regular CBC monitoring also plays a vital role in managing autoimmune diseases, such as rheumatoid arthritis and lupus. These conditions involve the immune system mistakenly attacking the body's own tissues, leading to inflammation and damage. CBC tests can help track disease activity, assess the effectiveness of medications, and monitor for potential side effects. Section 9. Take charge of your health. Make CBC tests a routine in a world where we can track our steps, monitor our sleep, and even measure our heart rate variability with ease. It's time to prioritize our blood health as well. The CBC test, a simple yet powerful tool, provides a window into our overall health, offering valuable insights that can guide us towards better well-being. Don't wait for symptoms to arise or for a health crisis to occur. Make CBC tests a routine part of your healthcare regimen, just like regular dental checkups or eye exams. Talk to your doctor about how often you should get a CBC test based on your age, health history, and individual risk factors. Remember, knowledge is power when it comes to your health. By staying informed about your blood health through regular CBC tests, you empower yourself to take control of your well-being and make proactive decisions that can lead to a longer, healthier life. Your health is your most valuable asset. Invest in it wisely by making CBC tests a regular part of your healthcare routine.
We share these stories so you can relate, offering community support to remind you that it's okay to feel vulnerable. You're not alone in this journey, and together we can help lighten the load. Let these stories be a source of strength and encouragement, showing that challenges are shared and solutions can be found as a community. You've got this, and we're here to support you every step of the way. If you enjoyed this video and want to see more health stories just like it, go ahead and click that subscribe button. It's completely free. And as a little thank you for subscribing, we'll give you a special voucher. This voucher will get you 20% off any of our laboratory products or money off every test or appointment for as long as you're subscribed to our channel. It's a great deal. And while you're at it, if you enjoyed this video, give us a thumbs up. It really helps us out and lets us know what you'd like to see more of.